We're going to be talking multiple sclerosis. This topic is very important because if you're trying to get a diagnosis, you're dealing with all kinds of horrible symptoms, and you just want to know what you're dealing with. There are many different conditions or diseases that have very, very similar um, manifestations, or I should say, lesions that we would see, and there can be a very significant opportunity for misdiagnosis. And the good news about all of this is that when we actually start to actually look, and we don't have to look too deeply, we don't have to be a scientist with a big biology degree or a medical degree, but just looking at the basics really helps us to see what is causing multiple sclerosis. So if we look at how MS is being diagnosed and we see all of the misdiagnosis, we see all of the conflicting results, and it really helps us to have a bigger, greater sense through this evidence that I'm going to share with you that multiple sclerosis and all other neurological conditions and all disease in general, the biggest cause are parasites. And the parasites get in the central nervous system, and parasites cause lesions. So that is the topic for today. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. Today we're talking about misdiagnosis of MS, and not just that, but we're kind of comparing, like, there are so many neurological diseases that have very similar what the doctors would look at as far as clinical symptoms, but also image evidence that they would see on MRI images. So, with multiple sclerosis, although it is a neurological disease, it's fairly common in Canada. Approximately 1 out of every 500 people are diagnosed with multiple sclerosis. And in the United States, it's about 1 in 1,000. And the incidence is growing. And it's not just for multiple sclerosis, but it's for many other conditions also. Make sure to type your questions in the question box, and I will answer them later, and say hello. So, multiple sclerosis diagnosis, it occurs, this is what they're saying, about 5 to 10% of the time. And it's more common that people are overdiagnosed with multiple sclerosis than underdiagnosed. And there are, as I mentioned, there are many conditions that mimic or seem like they could be MS, and there's at least 100 that they know of. That's a lot. So you think, pardon me, for myself, being diagnosed with multiple sclerosis 35 years ago, nothing has really changed. We still don't know what causes multiple sclerosis, and there is no cure. And then when you look at how MS is being diagnosed, we're going to wrap it up at the end, and it's really going to make you think. And I really hope that you ask your healthcare professionals some very important questions. So again, and I just listened to a lot of different experts, and they're saying that the misdiagnosis is more that people are being diagnosed with multiple sclerosis when they aren't. And it's shocking how many conditions have so many similarities to MS. So the experts are supposed to look for red flags, kind of things that would indicate that it is not multiple sclerosis. But in a general sense, MS is diagnosed through clinical observation. So you go into the doctor's office, and through MRI imaging, and sometimes through a lumbar puncture also. So common symptoms of MS would be things like, presenting symptoms could be things like depression and fatigue, vertigo, numbness, tingling, pain, bladder dysfunction, visual impairment, that MS hug, that where it feels like you're getting this hug around your rib cage, or and then also when you bend your head down, you get this tingle running down your back, your spinal cord, and also intolerance to heat. And then some of the other symptoms, clinical signs, would be tremors, where we have shaking of our limbs, and could be arms or legs, and then decreased perception of pain, vibration. Our reflexes are not the same, spasticity, limb position, poor balance, poor coordination. Those are some of the more characteristic symptoms of MS. So that's if you go into the doctor's office and you have those symptoms, they may consider that would like to consider that you possibly have multiple sclerosis. So those 100 disorders that mimic multiple sclerosis, some of them include things like microvascular disease. We're going to talk more about that in a minute. Migraines. I had no idea that that was so linked so closely to MS. And then also psychogenic, but I don't like that word because that's basically medically unexplained, maybe where it's all in your head. And when we're sick, it's not all in our head. Maybe they don't know what's wrong, but it's awful when we are told that it's just, you need to do something, stop being depressed, get on with your life when we feel absolutely horrible and sick. And then sometimes doctors say, well, it could just be normal physiology that maybe we're thinking that it isn't normal. But these different conditions that mimic multiple sclerosis in the MS world, in the standard of care for multiple sclerosis, if you are diagnosed with a different disease, are going to give you a different prognosis, like outcome, and also different treatments. But we know that all of the treatments that are for multiple sclerosis and for all other chronic diseases, they are maintenance drugs, and that's really important to know. So these are drugs we're supposed to take ongoing as long as our body will handle it, and they suppress different parts of our immune system. So the whole premise with MS and all chronic disease is that our immune system is attacking our own tissue, and we have to suppress our immune system. All right. So, one thing that I did like about listening to these experts, they're saying that if you're not sure, like talking to other neurologists, if you're not sure if this is a MS diagnosis, then don't diagnose. Don't just push a diagnosis on someone and prescribe medications. And I wanted to stop and back up for a minute that, I don't want to come down on the doctors. A lot of them have gone to university for 10 plus years. They've studied really hard. They're really academic, like they really know their stuff with what they were supposed to learn. It's just that, in my humble opinion, that they've learned a lot of incorrect information. They've learned a lot of information that really helps to promote the sale of disease-modifying drugs, but it's not helping us to recover. So I was diagnosed with MS 35 years ago, and I took a different path. I learned very early on that MS was caused by infections. I didn't know what I knew today back then, but it still worked, and because I caught it early, and we've helped so many people. I'm going to share just one success that just came in yesterday, and I have a bunch of them, but for time's sake, I'll just share one so incredibly amazing. So this is what people are doing, treating these parasites. So with MRI images, it's really complicated. So what they're looking for is they're looking for white spots, and sometimes they're called lesions or plaque, and it's an abnormality in the brain, and it can be like enhancing, growing. It can be circular, it can be symmetric, it can be located in different places. So really with the MRI, in the standard of care, they don't know what causes the lesions, and for some reason in the MS panel of experts, they don't feel that there's any value in trying to see if those lesions are caused by parasites. So they're not actively looking for parasites that could cause the lesions. They say there's no value in doing that. They are more concerned about where the lesions are located, how big they are they changing in time, like over time? Are they getting more or less of them? And are they growing or diminishing over time? So that's the huge disconnect. And hopefully through this presentation, you're going to get that. And these are the kind of questions we really need to ask our doctors. And I'll talk about that at the end. So let's look a little bit at just a few of the 100 different conditions that can mimic multiple sclerosis. So migraines, this is really common, that mimics MS. And women, of course, are affected much more than men would be. And they're red flag. So this is where neurologists say, well, there are characteristic lesions for MS. Usually, not always, like there's exceptions. So this is the problem. It's like there are so many exceptions, but in a general sense, there are characteristic lesions. We'll talk more about that later. But so the lesions in migraines, they feel that they are usually not characteristic of multiple sclerosis. Then there is also small vessel changes in the brain, CSVID, and the risk factors here are elderly. So what's really interesting is that about half of the population, when we get over 50 or 60 years old, we have lesions in our central nervous system. And I'm not saying that I'm the expert on any of this. I'm giving you an overview. And I do understand that with all of these different conditions that they have very specific guidelines of, where the lesions are located, usually how big they are, the types of lesions, etc. But so with this CSVID, there's a lot of people that are elderly that don't have MS but have these lesions, half of the population approximately, and they are white matter lesions, and that is very characteristic of MS, the location, I should say, but also women and people that have high blood pressure, diabetes, people that smoke, and people that have high cholesterol. And then number 3 is vascular related mimics. So this is where people may have night sweats and fever and like stroke-like symptoms, central nervous system lupus. Again, here they have white matter lesions or spots that mimic multiple sclerosis. And this is inflammation of blood vessel walls. And I'll just share it here right now, but what they normally find for multiple sclerosis is that the lesions are usually around a blood vessel. All right, that's really, really important, and we'll talk more about that. And many of you probably still remember, it's not as popular now, but CCSVI, where they have discovered there's a narrowing of the blood vessels in multiple sclerosis, and they can open up the blood vessels and sometimes give transient or temporary relief. I haven't seen a lot of permanent relief in the people that I've spoken to, and I've spoken to hundreds and hundreds of people that were diagnosed with multiple sclerosis, and a small percentage of them had CCSVI. I haven't heard one person say, oh my gosh, it was life-changing, made a huge difference, and all of those symptoms have remained. So there is this aspect of MS, which is a vascular aspect, so that our blood vessels are definitely involved. The fourth one would be Behçet's disease, and that is not a common disease, but it's a chronic inflammatory vasculitis again. Men are affected, young men are affected more. Lesions with patchy enhancement, red flags would be skin and arthritic symptoms. But some people with MS have lots of skin rashes and arthritis symptoms too. So this is why there is misdiagnosis with MS, because there's supposed to be these rules, but these rules are not really clear cut. And you would think after, even in my own lifetime of multiple sclerosis, 35 years, you would think that we would be closer to having clear cut guidelines for diagnosis. And in their minds, they do. But in ours, we don't, because we're still sick, we're still suffering, we're not getting better. So the next one is Susak syndrome, and that's considered to be an autoimmune. And I have an issue with autoimmune. I think it's more like probably some of our cells become infected and then our immune system attacks. There are many doctors that believe that also. So this is more common in females. These are all diseases that have lesions in the central nervous system that would mimic multiple sclerosis. Again, so for the Susak syndrome, white matter lesions in different areas of the brain. And the red flag, so it's kind of like, well, it can't be MS because these people, they have cognitive deficits or cognitive dysfunction early on in the disease, and they have hearing loss. And there are some people that have a lot of brain fog and a lot of cognitive impairment even early on in MS. Maybe it's not the norm, but it definitely happens. And then there's another one, CADASIL is another vascular mimic of multiple sclerosis, where stroke and transient stroke-like symptoms in young adults, and migraines with aura. So migraines again. Red flags would be family history. So they normally say that if you're going to be diagnosed with MS, you should not have a family history of MS. But I just spoke to a lady today that's going to be working with us, and her sister has MS, her father had MS, she has MS. So it does happen, and I'm just showing you these irregularities because this isn't good enough for us, right? This is our life, and this is not good enough. So another condition or disease would be neurosweet syndrome, which is fairly rare. Inflammatory skin condition, may be associated with malignancy, drugs infections, high fever, elevated neutrophils, and tender skin lesions. And so they're just looking at the types of lesions. So they're saying, well, there's more symmetric signs of lesions, and this is the red flag, and deep gray and thalamus lesions. So they're saying the reason it's not MS, it's not characteristic symptom or lesions that you would find in MS, but there are sometimes gray matter lesions in multiple sclerosis. Lyme disease, many of you have considered that you may have Lyme disease when you possibly have a diagnosis of MS. And so neuroborrelia, which is the bacteria that causes Lyme disease, it really can very closely mimic MS. And I've shared in one of my videos with what the MS Society says is that it's really, really mimics MS very closely. And then the red flags saying, oh no, this wouldn't be MS. Lyme disease would be totally separate from MS. They're like, well, you've got to see a bullseye rash, but a lot of people don't see the bullseye rash. And then arthritis, well, there's a lot of people that are very stiff and some have arthritis. And also they say the location of the white matter lesions. There's some other demyelinating diseases. So one is EDEM. I'm trying to go through it quickly just so you can kind of get a sense that there's over 100 that they know of. And so what they're doing is they're just basically saying, okay, there's all these people with abnormalities in their brain, different lesions, and some are big and some are small, and they're located in different areas, and some of them grow faster and disappear. So let's try to categorize the lesions. And that's how they're coming up with all of and yes, they are tying the clinical symptoms to, like the most common clinical symptoms to that. But again, it's still a mystery. We don't know what's causing the disease, and there is no cure. So this is not good enough for us that are diagnosed with disease. So these other diseases, there's ADEM, considered an autoimmune mediated demyelination. And this one could occur after infection, interesting, or after vaccinations. Could be an adverse effect from vaccination. It can occur at any age, mostly in men. And then there's a Marburg condition also, more in younger patients, widespread demyelination. That's what it causes. Lesions with incomplete ring of enhancement. And so that means to them that that is not an infectious disease. And I don't know that I would totally agree with that, but that's how they are diagnosing that. And then balloconcentric sclerosis. This one is rare, but it's pretty severe. Large lesions and demyelination and remyelination. And then tumefactive demyelinating lesion. So these lesions could be greater than 2 centimeters, often solitary lesions. So this one might be a little bit more rare or not characteristic of MS, but still considered it could mimic. And then neuromyelitis or Devic disease, lots of lesions, structures next to the central nervous system. Optic neuritis, posterior optic neuritis can be a result. So there are so many different conditions. There's also PML, the virus, JC virus that causes this. It could be due to AIDS if a person has AIDS, but it could also be due to using a specific MS drug that we're at risk of PML, which is a brain infection that can kill us. And then, okay, so now we're going to go on to the parasites. Oh no, one more. So neurosarcoidosis, and that can cause optic neuritis, so lesions there, and cranial neuropathy, and myopathy, and chronic meningitis. So these are just a few of the 100 conditions that can mimic multiple sclerosis. So again, they're separating all these conditions by symptoms, but a lot of it also is largely weighted on the MRI scan. So, like, what kind of lesions are present and where they are. But again, it's not cut and dry. It's not like everyone with MS has only these lesions. We're 100% sure. It's kind of like, well, this is usually the case, but there are exceptions. And that is why there are misdiagnoses, right? They have to consider, and that's why they're saying, well, if you're not sure, just don't diagnose somebody with multiple sclerosis. It's too hard to undiagnose someone, right? You don't want to tell somebody they have this horrible disease and then find out, well, actually it was something else. But again, the purpose of all of this is literally to give us a disease label so they know which drug treatments to prescribe. And the drug treatments are disease-modifying immunosuppressive drugs that we take as long as our body can handle it. And if not, they'll switch to the next one. So it doesn't cure us. It doesn't stop the progression of the disease. And yes, they have great science when these drugs are first released, but then after 20 years, then the real data comes out, and then it's like, oh, it didn't really do much, or it made people sicker. So now what I'd like to do is just quickly look at just a few different parasites that can cause lesions. We talked a little bit about this a couple of weeks ago. Toxoplasmosis causes cerebral ring enhancing lesions. So cerebral ring enhancing lesions caused by the parasite toxoplasmosis, and that is asymmetric target sign. So, like, because I know with MS, sometimes they're saying, well, it's too symmetric, the lesions, they can't be symmetric. This is asymmetric. So toxoplasmosis would be a protist that's causing this condition. And then more in the developing world, we have the neurocysticercosis, which I've talked to you about before, which is the immature or larval form of the tapeworm. It's in a cyst form. It's in a little bladder sac that gets in the central nervous system, and that can also cause lesions. And then other protozoa would be Plasmodium, so the different species of Plasmodium, like malaria, for example, and they can also cause lesions. And then there is alveolar hydatid disease, which is a flatworm, and that is a contrast-enhancing round solid lesions that this condition results in the central nervous system. Chagas disease, which is another protozoa that produces hypo-intense lesions that enhance, similar imaging to toxoplasmosis. So in the parasite world, they know that many parasites, they've observed this, that they cause lesions in the central nervous system. And it's not really just the parasite, but it's the immune's response to the parasite. The result is our lesions in the central nervous system. So I'm just giving you this, and I'm going to put all of this on our blog post, and I hope that you share this with different doctors and chiropractors and nurses, practitioners. There is a growing interest in parasites. So just share this. That's the only way we're going to get things to change. And then there are free-living amoeba that can also get into the central nervous system, and they cause single or multiple ring-enhancing lesions, both in the gray and in the white matter. There's a lung fluke that can get, we talked about flukes last week. So images show inflammatory changes in tissues surrounding clusters of lesions, which are contrast enhancing on T1. Frontal and temporal gray and white matter is mostly affected. So again, these flukes can cause lesions, or the immune system's response to the flukes results in lesions in the central nervous system. Schistosomiasis, which produce hyperintensive lesions, and they they prefer to, this parasite prefers to live in the spinal cord. And then there is another one here, and it is sparginosis, and that is MRI sometimes show linear or colvilinear contrast enhancing lesions and conforming to the shape of a worm, and frequently can be found in the frontal or parietal lobes, and rarely occurs in the cerebellum, brainstem, or spinal cord. So this helps you to see that there are two worlds going on. I'm just going to see if I need to finish anything off here. So there's two different worlds happening at the same place. There is and I'm just talking about MS, but arthritis, and every disease has their own experts, and they have their own way of diagnosing, and none of them know what's causing the disease. So in the MS world, we have this, where this panel of experts have come up with criteria on how we diagnose and how we treat multiple sclerosis. And they say, okay, we're looking for lesions in specific places, mostly, doesn't always have to be in specific places, but generally they should be usually they're in certain areas of the brain and the spinal cord. And they must, change or come and go over time. And yes, they do look at clinical symptoms too. They do take in the office and they do look for those symptoms that I shared at the beginning. But there are many different neurological diseases that have a lot of those symptoms. I work with the students, they have a lot of overlap. And with that panel, they're like, we don't know what causes the lesions, and there is no value in trying to figure out if parasites cause those lesions. So they're just like, let's just stay ignorant to what's causing the lesions. Let's just try to manage the lesions. Let's just try to use these drugs, these immunosuppressive drugs, to suppress our immune system, to see if we can kind of slow down the activity of the lesions, slow down the progression of the disease. That is the MS world. And then if you look at the parasite world, where they're studying, like, we know that the central nervous system is not a sterile environment, that parasites get in there. And I believe that I've talked about this before. There's research that sometimes really nasty bacteria in our gut and other parasites can produce toxins that compromise our blood-brain barrier, so that things are getting into the central nervous system that shouldn't, including different types of parasites. And then we're seeing that these lesions, they like to live around the blood vessels. So are the parasites very often coming in through blood vessels, where our immune system is not able to keep up with it because we have an infestation, right? And we have leaky blood-brain barrier. So in the parasite world, they're like, we know that, so many different types of parasites cause lesions because it's the immune system responding. It's like, think of it like an ulcer, right? Something like that, where your immune system is just trying to deal with the infection. And so they know that. But there's this disconnect. It's like this big wall between the MS world and the parasite world. And then when you start to look to see where all the funding is for these wonderful doctors that are trying so hard and really trying to categorize lesions into different categories and giving them different names, when is it just different types of parasites? And some parasites like to live in different parts of our body. Maybe they like to live in certain parts of our brain. Why was it so easy for Dr. Alan McDonald? He did work at it. He definitely is a professional, but he didn't need millions of dollars to find filarial worms, to find Borrelia, to find the tapeworm larval cysts in the central nervous system of MS patients. He did it on a shoestring budget. So why can't this panel figure that out? Why are they saying, and this is what we need to start asking our doctors, why do you not find value? If our immune system, the primary function of our immune system is to fight infection, to protect us from infection, then And we know that parasites cause lesions in the central nervous system. Why are we not looking to see what types of parasites? They'll say, well, no, sometimes parasites do cause lesions, and we know about that, but not with MS and not with all these other conditions. Like this is where we have to use immunosuppressive steroids and we use the disease modifying drugs. And it's like, no, actually, we haven't looked well enough. It's like there's no money in treating parasites, and I'm not blaming the doctors at all. They, if I was trained like that for 10 years and I'm a keener and I really care, I want to do my best and I want to try to figure out, okay, let's this category and this treatment. And so this is the system that we're in right now. And we're in this really awful system where, you know, 51%, approximately 51% of the general public, or headache patients, I should say, 51% of headache patients have bright spots. And again, really interesting that the lesions, they occur around veins, and then we know that with MS, we know that there's narrowing of veins. We know that parasites can infect the lining of our blood veins, our blood vessels. So, and we know that MS is a vascular disease because CCSVI is helpful for it. So this is the thing, is until we, the people that are diagnosed with MS and other chronic diseases, until we start to get people thinking, and it's working. Like we have professionals from all over the world reaching out to us now, healthcare professionals. We have healthcare professionals in our program that cannot recover from chronic diseases by using the immunosuppressive drugs, and they want to treat parasites. And we want the practitioners to be treating the parasites, right? We want them to take over and treat people early. That is the key. Early treatment. Then people can just have no damage, no disability. They can just get on with their life. Okay, I'm going to go to see some of your questions. Hello, Joanne. Hi, Michael. You're watching and cooking. Awesome. Hi, Natalie. And hi, Joanne. And here we go. So what happens because they have MS on Ocrevus infusions? Yes, that. So basically, Joanne is saying that what's really popular right now is Ocrevus, and that is an old chemo drug that has been repurposed for MS and I believe probably other conditions too. And the problem with that drug is that, and I'm not against pharmaceuticals, like treatments, like there are times if we're in a crisis situation that they can save your life, but that's in a crisis situation and using it short term. But with these drugs like Ocrevus, for example, it is destroying our B cells. And when we know that we're dealing with parasites, and we know that our central nervous system is not a sterile environment, we need our T cells and our B cells to protect us from parasites in the central nervous system. We do not want to end up with cancer. That's one of the adverse effects of chemo drugs. So then I don't know if, I'm sure you guys know how much they cost, those drugs, a lot. And that is why we're using them. So Joanne, you didn't have those symptoms. Lumbar puncture fluids were clear as well, but they diagnosed you with MS. So I don't know enough about your situation, but when they say that your lumbar puncture, like the spinal fluid was clear, that can mean clear of antibodies. I'm not sure. It doesn't mean that it's like see-through clear. Hi, Kevin. Treating parasites and fungus have helped greatly. Yes. Hi, Roz. Hi, Pam. And clinically isolated syndrome in multiple sclerosis, again, that is caused by parasites also, Louise. Clinically isolated syndrome is definitely it doesn't matter what type of MS it is. It's just that some of us are more infested and sometimes our environment is not good. So maybe we're, not sleeping. Maybe we're having a lot of urinary tract infections, so we're using more antibiotics. Maybe we're eating a lot of carbs. There are so many factors that will cause us to have more relapses and cause the MS to change from relapsing remitting to progressive MS. And for most people in time, MS does convert. And some people are very fortunate that they get that one attack and then they don't have any more future attacks, but that is not common either. Hi, Natalia. Hi, Joanne. So Joanne said, apparently I have 3 lesions on my brain. You never get a migraine, very seldom, headache even. So it really depends where the lesions are in your central nervous system. So if they're in one location, then you'll have balance issues. If the lesions, and these are like ulcers, think about them like that. If it's in another location, you might have numbness or tingling. In another location, you might have tremors. So I talked about the areas where they often find lesions in the white matter in multiple sclerosis and in the central nervous system. I did that 2 weeks ago. You can look back on either Rumble, or you can go on our website, livediseasefree.com. It's better there on our website because I've got all my notes there, so you can just quickly read through it. There's lots of links if you want to research further. Maybe tell me what GBS is, please. Facebook user. Hi, Debbie. So kill yeast in the central nervous. So that's another one is Candida. But we have found, though, stormy weather, that treating Candida is important. And when I was first diagnosed with MS, that was the first thing that doctors were talking about was Candida. There was the yeast connection. There is Candida by Dr. Luc de Shepherd. There was Dr. Orion Truss, the missing diagnosis. And there is a Canadian doctor, Dr. Rona, and he had the complete Candida guidebook. So that's where we started. And they did talk about parasites, but we did not know. So what we have found is that if you're catching multiple sclerosis and probably other diseases also really early, then herbs can be helpful. And the oxidizing agent that I talk about, that I can't talk about here, but you can find that on Rumble or on our website, using oxygen therapies to treat parasites. But we have found that just treating Candida does not get people the recovery. There is so much more than fungus. Fungus definitely needs to be treated, but we found that the tapeworm in the gut and tapeworm larval cysts in the central nervous system, and there's worms in the central nervous system very often. And Dr. Alan McDonald found 100% of the time. And then also we have found, like with my students, that flukes, intestinal flukes, and there's probably liver flukes, and there's, like I was sharing today, lung flukes, etc. So what we have found, stormy weather, is that those larger parasites, when you treat them, it's like shocking how much better you feel. You still have to treat the fungus, and then very often we have to knock back the Lyme infections also. Hi, Sherry. You have lesions on your brain and spinal cord. Apparently, the lesions on your spinal cord range from 3 to 7 millimeters. So, again, those are pockets of inflammation, pockets of infection, and you can heal them if you treat the parasites well enough. And if you just take immunosuppressive drugs, then it's trying to stop the war. It's like your immune cells are trying to fight the parasites. And so then the immunosuppressive drugs are holding back your soldiers. And the bad thing about that, Dr. Alan McDonald has even confirmed, is that when you have a parasitic infestation and you hold back your soldiers, that is not a good outcome. That's basically how he said it. Hi, David. What is the best treatments for the parasite lesions in the central nervous system? So this is evolving, right? And this is where I would not say, that there's a specific cookie cutter. So like what we do in the Live Disease Free plan is, number one, we help people to change their diet. So getting the carbs low, because the parasites love the carbs. And when you decrease them far enough with the Live Disease Free diet, then you notice significant symptom improvements in whether it's bladder, less spasticity, better strength, sleeping better, brain fog lifting, like double vision. I think we've had 4 students in just in the last few months that had double vision before, and just with diet, their vision corrected. So that's the first step. The next step is to support the body. So you should be feeling a lot better before you start treating. The third step is to get energy tested. So we have a checklist for healing, and this is where students they're doing a whole bunch of things to support the body, and they're just checking them all off. So they're looking at their blood work, supporting physiology, they're making sure they're sleeping at least 8 hours per night, they're having daily bowel movements. So I'm helping them with all of that because these are challenges for our students. And then when they're having a lot of symptom improvements and they've opened up their detox pathways and they're feeling a lot better, then they will start to work on building a game plan to treat. And then they'll get parasite samples of the parasite drugs from practitioners. They will then get energy tested to see which of the treatments are testing best for them through, and I've done videos on all of this too, so I'm not going to go into the details here. You can just find it on our YouTube channel and on I don't know about Rumble, but YouTube channel for sure, our website for sure. So the energy testing is really helpful if it's a good practitioner. One of our students this last week, it was like a total bomb, like really wonderful, really nice practitioner. But he's like, yeah, like he energy tested her and said, yes, you have flukes and tapeworms and roundworms in your brain. But then he said, you don't energy test well for any of the treatments. You just test well for herbs. And we have found that it's just not going to be effective enough to clear the parasites out of the central nervous system with herbs. So this is where it really helps, like when you're working with us, because we can help you to make sure that it makes sense to you. So then once you know what you energy test well for, then a practitioner writes a prescription, and then you use those treatments and you cycle through them. If you are just catching the disease early, whatever disease you're dealing with, then you might need 3 to 6 treatment cycles. You just want to go at least 1 or 2, like months of being completely symptom free, at least, because there's eggs, there's biofilms. And then as you are finishing that, once you have recovered, then what you want to do is you want to treat parasites, listening to symptoms, because we're going to constantly be exposed to parasites. We want to build back the good microbes in our body and manage that. But then periodically, we do want to treat parasites to keep it in a place where we never end up in this position again. We don't ever want to have a parasitic infestation again. Yes, the infusions. And Joanne, I'm not sure if you still are doing those infusions, but I would really suggest that you research it a little bit, because the adverse effect is cancer, and MS is bad enough. So as far as which parasite treatments, there are some treatments, and I've shared them on other videos before, but I'm not saying that any one person, it's a cookie cutter approach. It's like, what parasites were you exposed to when you lost your natural defense, when you were on too many antibiotics? But because of Dr. Alan McDonald's work and through the work of our students, that roundworms are usually an issue, right? And tapeworms are very often an issue, and possibly flukes. So not saying that all of them are an issue, but definitely very common. And so then you just have to use parasite drugs that are helpful for those types of parasites. But you need to use the right amount so that it actually treats them, because the parasite drugs are not a magic cure. And that's why we do the prep work first. And then we're using a combination. Usually our students will test well for 3 to 5 parasite drugs, and they're using oxidizing agent, bringing oxygen at the same time, and then they're also using herbs. The combination of all that, I'm just going to share with you from one of our students, just an amazing update from her. So I'm not going to say her name because she's in the program right now, but she might be listening, and I'm just so incredibly proud of her and so happy for her. So she got ready to treat, followed the diet, supported the body. She's a very smart, hardworking lady, really wanted her health back. And she just shared good news: after my first treatment, I have more energy, better mood. I'm a much nicer person than I was before. Like when we're sick and we feel awful, right? Our mood may not be the greatest. So she's been following the eating plan for about 3 months now, and she's lost 30 pounds, but she wanted to. You don't have to lose weight if you don't want to. She has no more brain fog. Her bladder has improved. She's able to dress herself easier. She's just done part of the first treatment cycle. And then it's easier for her to walk. Her balance is improving. And all of these things are getting better and better every day. And then she shared before she found the Live Disease Free plan, she said she was trying so many different things. So she changed her diet and lifestyle and her thinking and much more, but she couldn't put it all together. She was missing something. There's a piece of the wellness puzzle that was missing. And she said, it didn't matter what I did, I always felt like something was missing. And then she found the Live Disease Free program. She said, I knew that was it. I found all the answers to all my questions. So this is a student right now recovering from MS. My road was bumpy at the beginning. I had one good day out of 10. Then I had 5 good days out of 10. Now I'm at 9 great days out of 10. And the 10th day, just a good, new, exciting day, which is so awesome. So, and that's what she's been doing over the past. And so she's just treating. So she's got a lot more to go. So in only 3 months, I can physically feel how every cell in my body responds with gratitude and love and healing beautifully. Super huge thank you for all the love and care and grateful that I found you. So this is the possibility. Like, I can't do the work. She's doing the work, but she is treating the cause finally. And that is what the Live Disease Free plan does for you. It helps you to give you the roadmap, the blueprint, the proven plan. And then also you get myself to guide and direct you through that, because we still have questions. This is a new journey, right? And so we had a lot of different successes come in, but I just wanted to share one with you just to give you hope that there is a better way for you to treat that whatever disease you're dealing with. All chronic diseases, the biggest cause would be parasites. And as you treat the parasites, then the disease will stop, whatever we're dealing with, and we'll have a lot of recovery. It's always a lot more than we thought possible. Going to see if there's any last quick questions, and I'm going to let you guys go. Where are you? Let's see here. There we go. All right. Oh, wow. Okay. So Michael, or I should say, my Comage said I had tumefactive lesions. I'm learning a lot about lesions. I've been watching a lot of videos from different neurologists about lesions. And then Sherry just said, I have absolutely no pain anywhere, just numbness. At 5:24 p.m., and left leg drop foot went away, just diagnosed about a month ago, going to Illinois in a week. So if you're going for stem cell treatment, just know that multiple sclerosis, Sherry, is caused by parasites. And I've talked to a lot of people that have had stem cell treatments, and you might get some symptom benefits for a little while, but the parasites are still going to be there. That's the problem. You have to treat them. And if you are just catching MS early, then you could try the herbs, you can try the oxidizing agent, you can get quite far. But we have found that, this is where there is a point in time sometimes when pharmaceutical are helpful. And if it's just very short time to get these nasty parasites out of us, it ends up helping us to get back to normal. So if you haven't looked at my work yet, Sherry, I would encourage you to look at some of the case studies. You're going to see some of the parasites that our students have been passing, and they're huge and they're nasty. And like, I have passed worms like that too, but I have hundreds and hundreds of pictures. So you can spend $10 to $20 to $25 to $30,000 on stem cell treatment, but it's not going to get rid of the parasites. The inflammation will continue. You might get some short-term benefit, but then you're going to have to go back year after year after year, and it's going to be very the results will not last because the parasites are still there. The inflammation will continue. So, if you want to get your health and your life back, you have to treat the parasites. There is no, you don't want to live with them in your body for sure because they just keep multiplying. They move into different parts of the body and they cause a lot of damage and disability. So, you guys go ahead and type your questions in. We will answer them. Our team will answer your questions. And I just want to thank you for spending this time with me. I really hope that you share this information with different groups, get people talking. And of course, some people are going to say, no, I don't believe there's parasites, but we have to start talking about this. We have to start getting people thinking. And maybe after 5 exposures to this, then they're going to go, maybe there's something to that. And the more people that become aware that parasites are causing chronic diseases, then we are going to have a shift in our healthcare system. And so you guys are the foot soldiers. You can get the word out. I'm just doing my part. And I hope that you do your part so that we can make change come as soon as possible. So if you're new to all of this and you're like, this sounds really interesting, Pam, I want to learn more, I've got lots of videos on YouTube and on Facebook. Our website is the best, livediseasefree.com. We have blog posts. Go to the blog post and you're going to see videos and write-ups. The videos are condensed a little bit. They're edited. And then there's the notes. And you can, if you want to look for a link, then the links are there. And if you're at the place where you're like, Pam, I get it. I'm dealing with parasites and I want to get rid of them. I don't have a doctor to help me. I need help to be able to access all the treatments and the care that I need to get to recover from these parasites. Then what you would do is make sure to reach out and watch my masterclass training. The link will be beside this video. Watch it and you can learn how you can become a wellness champion. And I would be honored to support you if you're ready and if you need support. So please like and share and subscribe. And I will be back next week. Take care. Bye-bye for now.